In this clinical video, we will discuss a case of congenital motor nystagmus. Let's start with our case. 21-year-old female presented with complaint of jerky eyes since birth. There is no complaint of oscillopsia. Oscillopsia is a subjective perception of environment appearing to oscillate horizontally, vertically or torsionally. There is no history of similar complaint in any other family member. On examination, repetitive oscillations of the eyes horizontally is seen in all directions examined. These repetitive oscillations is called nystagmus. Have a close look on eyes being examined. On further examination, visual acuity was normal. Fundus was also normal in this patient. Nystagmus that presents in infancy and early childhood is usually either a congenital motor nystagmus or is secondary to an underlying ocular disorder. Coming to our case, nystagmus is present since birth, is horizontal and remains horizontal in all directions of gaze with normal visual acuity and fundus with negative oscillopsia. So a diagnosis of congenital motor nystagmus is made. Abnormal head posture was also noted when this patient was examined subsequently. These patients usually adopt an abnormal head posture to keep their eyes in the null zone to decrease nystagmus and improve vision. Patients with nystagmus usually present with decreased visual acuity, oscillopsia and abnormal head posture, which is usually noted by parents. Coming to our case, nystagmus is present in all directions of gaze including primary. Nystagmus in primary position of gaze is a troublesome disorder which is relatively refractory to medical intervention. Our patient do complain problem while concentrating on object, but again she got mentally adapted to it over years. As visual acuity is normal, so there is no question of its correction. Oscillopsia is also absent in our case. Visual symptoms of oscillopsia are usually absent when the onset is less than 8 years of age. As abnormal head posture was not noted by anyone, including patient, it means null point is near to primary position of gaze. Again, slight abnormal head posture in our patient doesn't need treatment.